T is for Tenecteplase. And in 2019, the ischemic stroke guidelines changed to allow Tenecteplase as a reasonable substitution for Alteplase in the setting of acute ischemic stroke. And this is a huge benefit. If you've done it before, you feel this with your whole self. Alteplase, if you've done it, is extremely difficult to dose and administer. There is waste involved with the administration. The bolus is 10% of the total dose. There's an infusion over an hour. So if you are shipping your patient off to a comprehensive stroke center, or receiving your patient as the comprehensive stroke center, there's always some question about, was the calculation done correctly? Was the dosing done correctly? If there's still volume in the, boy, I look rough. If there's still volume left in the bottle after the infusion's complete, was it done right? And you call back to the facility, no one knows. There's just a lot of questions. And so Tenecteplase really opened the door for a lot simpler dosing. It is FDA approved only for myocardial infarction for places that are not able to do PCI or cath lab. So the instructions on the box are for MI dosing, but stroke dosing is different. Stroke dosing is a lower dose than what is used for myocardial infarction. Stroke dosing is 0.25 milligrams per kilogram up to a max dose of 25 milligrams. So it is different than the dose, the little chart that's on the box. So a lower dose, but it is IV push over 5 seconds. So again, if you've done Alteplase before, this is a breath of fresh air. Tenecteplase, 0.25 milligrams per kilogram up to a max of 25 milligrams IV push over 5 seconds. It's awesome. We do still have all the same monitoring parameters every 15 minutes for 2 hours after the IV push dose. So all of that is still the same as far as vital signs and blood pressure monitoring. All of the inclusion-exclusion criteria is exactly the same. We have the same risk of angioedema that you had with Alteplase. We have the same reversal agents. If you have a bleed, the reversal agent would be cryoprecipitate and or TXA, tranexamic acid. But a lot simpler administration, a lot simpler dosing, a lot simpler infusion time, if you can call IV push an infusion time. The bleed risk is exactly the same. We quote 30% complete resolution of symptoms, stroke symptoms at 90 days with a 6% conversion to bleed from complications. So exact same percentage. It was a non-inferiority study that allowed us to change, or not us, allowed them to change those guidelines. And so that shows that we can't say that it's better or worse than Alteplase. And so we quote the exact same efficacy and the exact same risk, again, just with a lot simpler dosing. So that is the story for Tenecteplase in acute ischemic stroke. It has been a breath of fresh air. Like I said, if you've done it at your facility, we made the change back in 2020. So if you have done it at your facility, it's huge. But yeah, T is for Tenecteplase.